ready, right now we're going to work on something called hip smash, okay? Specifically in the hip, we're going to be working on an area called the piriformis. Wendy, come on over to the muscle guide for a second. Piriformis is a muscle that's deep to the gluteus maximus and goes from the anterior side of the sacrum, that keystone bone in the pelvis, to the outside of the hip, okay? Now, on Americans, this is tight on a lot of people, okay? It can cause sacroiliac dysfunction, it can cause sciatic nerve pain, it can cause a lot of different types of issues. It can also cause you to flare your foot out when you're walking. So we're gonna work on loosening that up. When you do this, you're gonna sit down. You're gonna locate something called your greater trochanter, which is that bony prominence on the outside of your hip. From here, you're gonna wedge that lacrosse ball right into your hip. You're gonna lean back and get pretty lazy with it. I like to straighten the opposite leg, keep the leg on the side that you're working bent. And then you kind of just work around that glute and drop that leg out until you feel a release. One thing I notice with a lot of my patients is that they like to sit up a little too high when they're doing this. This shifts their weight lower than the lacrosse ball. So with this one, you have to be almost pretty lazy with it. You don't have to spend quite as much time on this one since it's a lot smaller area that you're working out. So you can do about 30 to 45 seconds for each side.